with Chris Fearne, Deputy Prime Minister and Minister for Health.
Good morning. Ever since 1.4 million years ago, Australopithecus managed to control fire, humankind has been using its scientific knowledge to better our lives. So to make our lives easier, to make our lives hopefully happier, to make our lives more pleasant, but also to make our lives healthier and possibly to make our lives longer. So the use of technology in medicine has been around at least for 1.4 million years. Maybe what's new today is that it has a new fancy name, MedTech. But technology in medicine has been around for centuries. Having said that, the advances in medical technology over the last 150 years probably total as much as the medical development, the medical technology over the previous 1.39 or 1.3998 million years before. And the advent of the internet, the advent of Wi-Fi, the advent of digitalization, of machine learning, of artificial intelligence, of robotics, is accelerating the opportunities for using technology in the medical field, for making our lives healthier by applying our scientific knowledge in a practical way, which is what technology is. The opportunities are endless. I'm sure you'll spend today and the rest of the day talking about the different opportunities available, ranging from stuff like electronic patient records and e-prescribing, to remote patient monitoring, to the use of robotics in theaters and labs, in pharmacies, to the use of machine learning in ophthalmology, in radiology, dermatology, and a lot of other uses. Telemedicine is one of them. But what I would like to spend a few minutes discussing, and possibly even to answer Stefan's question of what you would need to tell me to convince me on the use of a new technology, is exactly this, is what we've learned over the last few years, possibly some mistakes, possibly some pitfalls, but more or less what is required of a new technology for it to pass the grade, for it to make the grade and be available, and to make itself available to our patients. So first and foremost, the one most important thing, probably, because as medical people we are somewhat conservative, is that the new technology needs to show that it has added value, that it brings something more to the table, to the patient, to the service, than what we already have. So just having something new, with a fancy name or a shiny cover, or something which companies will tell you this will make your life better. Unless you can actually prove that to the medical people who are going to use it, then it's going to be very difficult to introduce. I'll give you an example. Telemedicine has been around for a number of years. Practically everybody has had contact, has had access to a telephone for the last 50 years. Fine, smart mobiles have come in over the last 15 years. Everybody has access to an iPad or a tablet or a computer or a laptop at home. Practically every household has this. Yet, telemedicine, up to a few years ago, was something that possibly you read about in the bush in Australia. It wasn't really happening, certainly not happening here. Despite the fact that as an outpatient, you would have patients who come in regularly just for you to say, just from some reassurance, or for you to say, yes, I've had a look at your MRI, I've had a look at your CT scan, your renal cyst hasn't grown, let's see you back with another scan in 1 year's time. We have hundreds of these patients coming to our outpatients clinics, and they would be excellent patients for telemedicine. And yet, most doctors weren't convinced that this was something that they needed to do. What changed it? Because now today, telemedicine in Malta certainly is a big thing. We have a telemedicine center which services thousands of patients a day. What changed it? The pandemic changed it. There was an added value for you not to have patients coughing in each other's face in the waiting room and coughing in your face in your clinic. So those patients you could see over the phone, or those patients you could advise through your laptop, then that was the way forward. And because there's an added value, then telemedicine came in. So the first thing you need to do, the first thing you need to show with your new technology, if you want to convince me and you want to convince your CEO, is that there is added value to what you are proposing. Secondly, it needs to be easy to use. So some doctors, like Stefan, are very good in technology. Most of us are complete idiots when it comes to using technology. But we are the people who have to use it. And it has, sometimes we forget this. It has to be easy to use by all users. I'll give you an example. We've just set up over the last 3 years, we've set up a robotic system in our pharmacy. Yeah? So there's a robotic system which packages medicines into unit doses. They're whizzed through the pneumatic tubes to the bedside, and the patient gets, theoretically, within minutes of the doctor ordering the new medicine is there in an individually wrapped pack with barcoding, and the patient gets that medicine. The pharmacy love it because it frees the time, and they can spend more time on the wards with patients. The administration loves it because it cuts costs, it removes errors, it allows accountability of where your stock is, and it makes stock taking and replenishing of stock easier. But when it came to using it, doctors found out that it took 2 or 3 minutes to log in. Doctors don't have 2 minutes of their busy life to spend logging in onto the system. And nurses found that it took an extra 1 or 2 steps to make it happen. And we have problems with implementing this. So it has to be easy to use, and it has to be easy to use even for idiots, technological idiots like me. It has to be something which is extremely user-friendly. Having a new bit of technology, which has a proven value, but which is difficult to use, will fail. So if you want to convince me with a new technology, it has to have added value, and it has to be easy to use. Then it has to be safe, and it has to be foolproof. We're setting up a system at the moment to revamp our emergency response, right? So our ambulance service and the emergency response time. We want to cut that by a few minutes. Those few minutes could be the difference between life and death. So what we're doing is we're setting up a new control room. We have a new fleet of ambulances literally coming onto the island within the next few weeks. We've set up a system whereby we have roaming cars with paramedics around the island all the time. And these are all connected through an artificial intelligence system to the traffic cameras around the island. So at any one point, we can know what the traffic is like anywhere around the island, and which is the fastest route, and where to deploy our services from to reach the patient, possibly 3 or 4 minutes before we would otherwise do if we didn't have this system. Those 3 or 4 minutes can save a life, so it's worth doing. Yesterday, the 𝐂𝐨-𝐲 ambulance service in the UK, part of the British NHS, which have a system slightly less sophisticated than this, the IT system collapsed yesterday. And the waiting time for an ambulance, not only did it not come down by 2 or 3 minutes, but it went up to about an hour. So having a system which is extremely useful, proven value, easy to use, but which fails is a problem. So we need to make sure that the systems we have been validated, have been proven to work. because we cannot afford, we're talking about life and death here. We cannot afford to make mistakes with our patients' lives. So if we want to convince the administrators, if we want to convince the professionals using the system, if we want to convince the patients to allow us to use the system on them, we have to show that the system works every time, and that it is safe to use, and that it is easy to use. So it needs to have added value, it needs to be user-friendly, it needs to be foolproof. Then it needs to be secure. Data protection is important in all spheres, but with medical data, it is extremely important. Medical data is personal, medical data contains, for the individuals involved, possibly explosive information. Any system which is brought online not only needs to satisfy the GDPR requirements, but it needs to be absolutely hack-proof and safe. And any system that aims to convince administrators or buyers or authorities that this is a system that we should be using needs to have needs to prove absolute certainty when it comes to security. And then, of course, any system that you bring in needs to be able to communicate with the systems already in place. So going for silos that won't work. So there are very many different bits of the medical system. So from GPs in the clinics, in the villages and towns, to primary care, to the hubs, to hospitals, to wherever. So there are different bits of the medical service, but there is only one patient. Right? Ideally, the data would travel with the patient. Blockchain would be extremely useful in this sense. But what we cannot afford is to have systems which come in, which do not speak or do not communicate to the systems we already have. Now, whether this is a piece of equipment, whether it's a bit of software, anything that comes in needs to integrate with the rest of the system, because there's only one patient, and the care of that patient needs to be seamless and integration. And then finally, whatever effort is made to bring in new technology needs to be accompanied by training, so staff training at all levels, extremely important. By communication, so we need to not only communicate with the patient, with the people using it, but also with the people on whom it is being used, because that is extremely important, and transparency. If people feel that something is happening behind their backs, they will not trust it and they will not use it. So transparency, training, and communication are key. My lights are flashing, so I'll come to the end. People say if you play with fire, you'll get burnt. True. But can you imagine our civilization without the use of fire? So the fact that 1.4 million years our ancestors started to use fire, it's true. Over the years, many people have got burnt. But can you imagine our society without that bit of technology? And it's the same here. New technologies, fine. We can have setbacks, there can be mistakes, but medical technology, the new medical technology, is essential for us to keep getting our service right, for us to keep getting our service better, and for us to keep giving the essential health that we need for our society. So the answer is, go for it. MedTech is here to stay. Thank you very much.